Dr. Paul Skomra, thanks for being here today. Known you since, God, we were what, 10?
Yeah.
It's been a long time.
It's been a long time.
Yeah, man. Always good to, we kind of disconnected for a little bit there, but over the last few years reconnected, and always been a pleasure chatting with you about all things health related of late. So today's really about understanding as a concierge, primary care physician, right? What you're seeing in healthcare regards to risk, health decisions. Before we dive into that though, let's give the people a little background on you, what you're doing and
Sure.
how you got here.
Yeah. First off, thanks for having me.
Of course.
It's been a long time. We've been following each other on, Facebook, Instagram, and it's exciting to see, your journey and happy we're both back in the community we grew up in, serving and educating the folks. So I'm a primary care doc. I do concierge medicine. As Blake had said, I'm from the area and proud to be back. I was gone for a bit doing some training in the Northeast and Philadelphia and New York City. So seen a lot, demographic-wise, medical-wise, a lot of, disparities, a lot of different demographics, socioeconomic issues, but learned a lot. And I also learned what I think Florida has been missing in terms of just like academic institutions and continuity of care and just a cohesive care for a community. So I think me coming back, I've been trying to help solve that issue. So I do primary care, concierge care. I transitioned to that about 3 years ago.
What were you doing previously?
I was doing basically primary care, outpatient medicine, 20, 30 patients a day.
Wow.
Traditional medicine, you would call it. But I would call it reactive medicine.
There you go. We're going to get all into that. I'm excited for that part of the conversation. So in terms of high-level patients that you see every day here in Palm Beach, what do most of them think they understand about their health that they actually don't?
With these high-level patients, intelligence, perseverance, and just being rigorous and aggressive about your health is not always the right solution, because, medicine is not in silos. It's a very cohesive and overlapping biology and system-based situation. So I would say most of my patients come in and say, I've done X, Y, Z. I'm checking all the boxes. All my standard labs look good and great. But I think most people have the inability to zoom out and look at the bigger picture, because going aggressive at everything doesn't automatically mean that you're healthy, because there could be something underlying, something they need to focus on, something they're missing that traditional medicine is just not picking up on.
I love that approach. And I think we can clarify a little bit because, right, everybody would think, hey, being aggressive about your health is a good thing.
Sure.
In theory, 30,000 foot view sounds fantastic.
Yeah.
So where does it become a problem, right? Like if somebody is coming in, right, they're doing all these things and they're being overly aggressive, like how does that show up in practice for you of like, this is actually making things worse? Or,
Sure.
Yeah.
So I wouldn't say it's necessarily a problem. I would just say that folks are they can be aggressive about the wrong things, and it could actually be doing them more harm than good.
Where does that come from? Like if they're maybe being aggressive about one thing that they shouldn't be overly aggressive about, where do you see that surfacing from?
I think that there's just so much information out there, and there's trendy things with medicine. There's new and exciting elements of medicine that are coming. There's a huge evolution with AI. So there's a data, there's so much data out there, and it's tough to decipher, what's good and bad and risky or safe. So I think a lot of folks think that there's this holy grail solution to things, whereas I believe it's much simpler than that. I think that a lot of folks are missing the foundations and they're looking for a quick fix.
Absolutely.
But I don't necessarily think that's their fault. I think that's kind of the world we live in now.
Absolutely.
Quick fixes, and
it's human nature too.
Yeah.
Right? Like we want, we need the instant gratification, we need instant feedback, like the therapies that we're doing or things we're deploying. We want to feel that it's actually working. We don't just want to trust that, hey, I'm going to get the benefit of this 10, 20, 30 years down the road. In the work that we're doing on our side with QLP, and you and I have had a lot of talks about it. We'll dive into it more. it's that information overload. And it's a problem across every area of our society. There's just so much information. It's like, how do you discern
Yeah.
what's good, what's bad? And now you have Dr. AI on top of it,
Sure.
right? That you're contending with every day. And it's like people are going on and research. It used to be WebMD or Dr. Google. Now it's Dr. AI, and people think that it's kind of this end all be all. How does that show up in your practice?
I think some patients are more involved with AI than others, and some people lean on it much more. I love it because I said more data is not a good thing, but that's not true. I think that you just have to have somebody or some way to zoom out, see the big picture, look at trajectories, and not necessarily snapshots. So
Yeah.
um,
We see that all the time. And on the longevity side of our facility, we have, we're doing blood work, right? And blood work's great. It's a great diagnostic tool. It's been around for ages, and it's kind of the gold standard of how we diagnose things. But it's a snapshot,
sure.
right? And then we react to it. Then 12 months later, we do another snapshot, then we
Sure.
react. And especially in our space, and everything's kind of trending towards this longevity, verbiage. We're supposed to be preventive, but we're still reacting to something that's already there.
Sure.
And maybe we're doing it 10 or 15 years earlier than our parents did, right? But it's still this reactive approach. So in your practice, right, when people realize that, hey, this is kind of still just a reactive approach, like blood work, like I want to do something else, what kind of things are they seeking out?
I would say advanced imaging, genetic testing. Some people don't know what they're seeking out, and it's up to us to educate them, what's fluff, what has real, power.
What do you think has real power? What diagnostic tools?
I would say advanced imaging, full body MRIs are good and great with certain caveats, which we can discuss now or later.
Yeah.
Genetic testing can be great. All of these, by the way, could be super anxiety producing. So make sure if you do those, you have somebody overseeing it and helping you make sense of it and not overreact or panic about it. But so genetic testing, advanced imaging, advanced biomarkers, lipid panels, advanced lab work, some things we could pick up disease before it kind of rears its ugly head. So I would say that there are many lagging indicators, and there's a huge gray zone in medicine that, before a disease has time to manifest, like high blood pressure or diabetes, there are very nuanced things that you could check that are not traditionally checked that we could do.
So you touched on the anxiety, right, that can sometimes be created by diagnostics, right? And we see it in our facility, right? At the Fountain, if we're doing full body MRI, functional DNA, bioage, pace of aging, nutritional sensitivity, advanced blood work panels, we have 800 pages of diagnostic data that the patient's then going home with.
Yeah.
And even within, let's stop there. We won't advance from there. The anxiety that patients are experiencing, right, from all the data, is sometimes too much data a problem?
Yes. Too much data, I definitely believe, is a problem. Synthesizing it and making it something that is user-friendly and patient-facing, I think, is the solution. But I don't think we're there. I think we're getting close. I know that, I send you links all the time, probably too much.
I love them.
About
Keep them coming.
I think there's software coming out, and there's going to be ways where this is integrated into the EMRs or the platforms we use to look at patient data. So it's kind of a cockpit or just like a bird's eye view of a patient's trajectory. So I think that overall, too much data is not bad as long as it is digestible to the patient and to me, so I can help explain it and, help reduce some of the anxiety that comes with that.
So at a certain point, right, with all this data, and I'll speak from our experience at the Fountain. So we have patients come in, right? And if they do all of our diagnostics, they get 800 pages of diagnostic data. Just under our roof, they're seeing or speaking to at least 4 different physicians and providers, from full body MRI, the genetic stuff, nutritional sensitivity. We have a dietitian, blood work. They're sitting with a nurse practitioner. And because each diagnostic is looking through a specific lens, and each physician or provider on top of that has their individual lens they're looking at the problem through as well.
Sure.
The patient ends up with kind of conflicting priorities, right? And then
Yeah.
most of the patients that are doing that have a concierge primary care physician. They're like, hey, I want to come,
Yeah.
I need to go talk to Dr. Skomra and talk through all this so I can understand it. Then they're going to talk to their cardiologist and so
Yeah.
forth. So how in concierge medicine, right, are you guys dealing with conflicting expert opinions, right?
So I would say that I often do not deal with a lot of conflicting advice.
That's maybe not the best term. I
Yeah.
don't want to say conflict. I say conflicting priorities.
Correct.
That's a better way to put it.
And I'd agree with
Yeah.
that. I think that my job is to kind of quarterback and help set up a prioritization protocol, like look at all of this and say, hey, concentrate on this more than this. You have a incidental mass on your liver that, you're losing sleep over, but your calcium score is through the roof. Your heart health is really not good and you're pre-diabetic. So at that point, you'd have to focus on what can do them the most harm and what we can intervene on the most, which is typically metabolism, cardiovascular risk factors, stuff like that. So,
Got it.
I wouldn't say there's a lot of conflicting recommendations. I would just say that there's conflicting priorities. So I fully agree with that.
So where do you feel like the current system does a good job and where do you feel like it falls short?
I think the current system does a really good job at diagnostics. And, when we have to react, we could do it well. There's protocols in place. And I think that that's a deep discussion on why that is. But I think that that's, incentivization for payment. And, it's an easy thing to say, this is broken, let's fix it. And it's easy to document and bill for and get paid for. But what we should really be focusing on preventing that from bubbling up in the first place.
Absolutely.
Yeah.
Yeah. And that requires decades in advance
Yeah.
planning a lot of times, which we'll dive into more in just a few minutes. Yeah. So talking about all the different diagnostics, right? You mentioned full body imaging. You have sent patients to our facility for body view. Tell us a little bit about, why you're sending them over, what you're looking for, kind of what starts that process in your mind.
So a lot of folks come to me and they say, what can I do outside of what has been traditionally done for me in terms of every 6 months we get a slew of blood work, everything is in the green, so I'm technically good, but what am I missing? What is all this noise about full body MRIs and peptides and stem cells and all this other stuff? Is there anything out there I can do? And sometimes cost is not really a barrier for them, which is a good thing. So I would say at the forefront of what you could do preventatively, holistically to look for something is to image yourself, right, with a full body MRI, because it could look at soft tissues and tumors and, arthritic changes, things like that. So that is where I would start with imaging, because you can't really argue when you see a mass, that is something that you should keep an eye on. So I would recommend it with a lot of caveats, right? One being the cost. Mm-hmm. But if that is not a barrier, then the second thing is how anxiety producing is this going to be for you if you find something that needs to be monitored, mm-hmm. right?
Expand on that a little bit if you don't mind. So the anxiety part, I think we all understand, right? If there's an anxiety about, hey, what if I find, let's say, an actual cancerous tumor that I need to then start treating? That's one scenario. But expand a little bit on, we find something that we have to monitor and how that can create anxiety. Like, what are we talking about specifically? Like, what can we I have an example for myself, but I'll let you explain it. What's something we could find that would require monitoring long-term?
Sure. So I would say incidental cysts or things that look like benign tumors, which are very common. Mm-hmm. Typically, you see them in the thyroid, or you see them in the liver, or on the kidney, or the pancreas.
I had a pancreatic cyst.
Yeah.
Thank goodness it was a cyst and not a tumor.
Correct.
Yeah.
So that's one that, folks rightfully so get super anxious about, mm-hmm. because that's a very bad prognosis if it turns into cancer. So I would say that I see a lot of incidental tumors, right? And for the most part, I'm able to say, this looks reassuring, let's monitor it. And that's the good thing with these folks who go in there with no financial boundaries, because re-imaging that and having the time to go and do that is something that's very doable for them. But folks who are on a busy schedule, who, they're traveling internationally, for instance, don't have the time to monitor, that can become an issue.
And that's the thing that's kind of baffling to me,
Yeah.
right? And that's maybe a societal problem as a whole, either whether we're talking about financial constraints
Yeah.
or time constraints. Shouldn't our health be a priority?
Yeah, I would argue it should be the number one priority, because
Yeah.
without that, you really do not have anything.
Exactly.
So, but yeah, I think it comes it produces anxiety in the patient, but sometimes in the provider, because I do have patients that are traveling and, they're not great at follow up despite, us reaching out to them. So, you always worry in the back of your head that, something's going to be missed. Somebody's not going to follow up, but, we try our best to explain to them, this is important to keep your eyes on. So,
Yeah.
yeah.
So what type of patient do you think benefits most from a full body scan?
Somebody who can understand what can happen either way, and that are willing to continue it if it's deemed necessary or recommended. So,
Got it.
yeah, and somebody that would understand the fact that not all things that are flagged as abnormal are ominous or terrible.
Yeah.
Yeah.
So there are other options out there, but I do a shameless plug opportunity here for BodyView. A lot of other options out there besides BodyView at Encore Imaging. Why do you go with us?
Because I love you, Blake.
Thanks.
I think you guys are great at, first of all, you're super responsive, right? You get folks in very quickly, and you're thorough with the explanation. So I think communication is one of the biggest strengths, and it can be the biggest weakness of a practice or in medicine in general, right? The way we communicate to each other via phone or through our platforms, a lot of things can get lost in the shuffle. So the communication piece is huge. The technology piece is huge, because you guys have amazing imaging, but also just the trust I have in your operation.
Awesome. I appreciate that. So getting into QLP, Quantum Longevity Protocol, you and I have had a few very interesting discussions about it. And it's unintentionally, a lot of the conversation we've had today is kind of leading us right into it, which is cool. So out of everything we've talked about, what's interesting about it to you? And if you need me to give you additional context, like we can dive into that as well.
Well, I firmly believe it's the future. I mean, I think that integrating personalized patient data and looking at trajectories is just the way it needs to be. It's the way it should be. Mm-hmm. It's just the things I worry about is just the things getting lost in all the data, and there not being one way to synthesize it and prioritize it. So if you solve for that, and I think it will be solved soon, if you're not going to solve it, somebody else will.
Yeah, but, absolutely.
I think that more data is an amazing thing in the right hands of the patient, in the right hands of the provider. It's just how we're going to synthesize that, make sense of it, and intervene when we need to.
Love that.
Yeah.
What's clear and unclear? What parts of the program of QLP do you understand? Like, hey, I get this. And then there's probably parts that I haven't explained well, or we haven't really discussed in a lot of detail.
I would say what it does right is there's a lot of great integration that you do. And I think synthesizing priorities is a huge strength, especially if you're considering what we can intervene with, what we can intervene on. Mm-hmm. So sometimes you get genetic testing back and it looks at your propensity for XYZ and there's nothing to do or nothing to intervene on. But what I think that the QLP does great is it focuses on things like cardiovascular health and cancer prevention and monitoring, which help me out as a provider to really keep eyes on that. So weakness-wise, I would just say for a traditional primary care doctor, or any doctor for that matter, time is very precious, and it takes time to go through that. Yeah. It takes time to synthesize everything and agree or disagree with.
Yeah.
So a lot of data is a great thing, but we need time to go through it, and that's a rarity in my profession.
Yeah, and time is not a resource you guys have a lot of. Initially, right, and we've talked about this with all the data, and this was kind of born naturally out of just what we're doing on the longevity side of our practice, with so much data and so much information. Then we have kind of it's like, what's important, what's not. And like you said, it's like physicians can, I think, individually look at those things and spend a lot of time kind of
Yeah.
dissecting and identifying what's super important. But I think you would agree, right? If you get 10 concierge primary care physicians in the same room, may have some differing opinions as to what's priority. And so what QLP does initially, and this is really critical, is clarifying signal, right? So what's signal versus what's noise? I'm sure there's a lot of data and diagnostics that your patients react to that they're really worried about. And you're kind of like, this is not something that you need to worry about or need to focus on, like the benign tumors, right? Or cysts, for example. Like when I first saw a pancreatic cyst, I know a cyst is not a tumor, but I still kind of freaked out. But after speaking with a physician and having some understanding around it, I knew like, okay, it's worth monitoring, but it's not something critical I have to take action on right now. So how important in your opinion is, across all the diagnostics, identifying what's signal versus what is noise?
I think it's very important because there's a lot of time wasted and, time, financing, whatever, a lot of resources wasted on paying attention to noise.
Yeah.
So
in our industry, mine specifically, not so much, I mean, maybe in concierge some, but specifically in longevity, the way that the business model is set up, we've really capitalized on that chaos. And it's kind of dirty. It made me for a long time not feel great about where the industry was heading. Unfortunately, we've decided to go in a different direction, but it's like you have all this diagnostic noise in between imaging, genetics, blood work, hey, patient X, like here's all the reasons why, all the things that are wrong with you and all the things you need to take to get better. And we just happen to also charge you for all those things. And so that's why we're going to recommend you do all of it.
Sure.
When really like half of it, they probably don't need. Do you agree with that statement?
Oh yeah, 100%. I think it's a predatory environment in Florida and like everywhere. It's a capitalistic society. So people are going to capitalize on the noise. They're going to scream that I have a solution for X, Y, Z. And, longevity is a big word. Concierge is a big word, but these things are not all encompassing. And you could easily fall into the trap of, these things are wrong. See, look at these labs, you're deficient X, Y, and Z, buy our supplement and, go through our protocol. That's all cash pay. It gets a little bit dicey there.
It does. And if we look at it from a macro level, right, you look at traditionally the roles that doctors have played in our society, and they're kind of, they can tell the president of the United States, like, turn around, pull your pants down, and he's going to do it because it's a doctor telling him he needs to do this.
Not anymore.
Not anymore. Maybe not anymore. Yeah. But in previous years. So it's almost like we took advantage of that situation and now use that person as almost a salesperson to like, here's all the things you need. Right.
Yeah.
But I do believe that patients, especially educated ones that have been down, the concierge longevity pathway for a little bit, starting to wise up to it.
I think so too.
And there seems to be a real hesitation for people to move forward and deploy those therapies in the back end, because whether they're consciously aware of it or not, it's like they're sniffing out like, this person's selling me something,
I think there's healthy skepticism in medicine, but it could easily get a little bit too skeptic. So it's our role to, gain the trust of our patients and, not go down any rabbit holes and really just focus on what we know is going to do no harm. So I think that's where the issues lie, is that.
And that's kind of the tricky thing in longevity as well, is most of the therapies that we're offering on the back end, like, they're not going to hurt you, but they may not be helping you either. And you're spending your hard-earned money on it.
They can hurt your wallet.
They can hurt your wallet. Yeah. But if you get a doctor or physician provider is telling you like, hey, you need this stuff, like people are just kind of going along with it.
Yeah.
So for me, it's always been, I've been very big in every industry I've been on finding where what's best for the business is also what's best for the customer or the patient in this case. And that model is just something that was icky about it. Right.
Yeah.
And we don't over recommend it, but it's like, there's this uncertainty because of all the data, right? That it's like, hey, are we covering all the bases? We're probably going to naturally trend towards being a little bit more aggressive just because we want to make sure that we're covering everything. And it's really what kind of forced me into, or a big motivating factor for developing QLP, right? Because QLP also, whereas most of the healthcare industry, I think, rewards action, this system also rewards restraint, right? When do we not deploy something? So on top of identifying, right, what's signal versus what is noise, we now have a prioritization of health risk mitigation first, very clear example. You get the full body MRI and there's a tumor.
Yeah.
Well, we got to make sure you're not dying of cancer before we focus on health span and optimization and all those other
Sure.
things. So health risk mitigation first. That can also mean long-term health risk mitigation. So what genetic and structural factors exist that, hey, Blake, Dr. Skomra, you can't sustain this for decades without causing serious harm to your body. Once we kind of identify those things, intervene, right? Then it's longevity / health span from there. How do we keep you feeling your best for as long as possible? Once we check that box, then it's the optimization of here and now. Like, how do we get you feeling your best today? Do you agree with that sequence?
Yeah.
Yeah.
Yeah. I have nothing to add to that. That's how I would approach it.
Cool.
I would say the boundaries there lie in just convincing the patient of that, but convincing their providers of that too. Because although your information I agree with, it may be met with skepticism from somebody who doesn't know you or trust the data or how you're pulling it. So, and then
what kind of skepticism do you think? Like,
I would say,
curious, yeah.
I would imagine, like I haven't dealt with this personally, but I would imagine if you go to a traditional primary care doctor, you have 15 minutes with them and you pull out 8 pages and say, this is what I found. Can you help me decipher this? It's going to be a tough time for the doctor to go through that in 15 minutes and, agree or disagree with it. So I just think that our system is not set up for this yet.
Yeah.
It's not incentivized for this yet. In the private sector, yeah, but I think insurance needs to catch up.
And I think that's kind of that's been the focus, and that's kind of the patients that you and I both deal with. The objective has been to identify people that recognize the shortcomings of the traditional approach, right? And so they may be okay, because all of this being physician synthesized, like you and I talked about you being involved and other physicians. But so it's not like we have some program out there creating all this stuff and like we're putting our stamp, but like it's being reviewed by physicians and of course getting the stamp of approval. But I think the patient has to be in a place where they recognize the issue of the fragmented, segmented care and data overload, and they can feel comfortable. And I think a lot of patients ironically are already doing this, but honestly dictating their care, but feeling confident enough if they need to go see a specialist, be like, hey, this is how I'm managing my healthcare now. And I need you to help me, be on board with this and help me instead of pushing against it and like have those really hard discussions.
And I think what we talk about a lot, you and I, is just the players in the community that are more receptive to this information, have the time and the patience and the understanding to navigate it and address it. So I think that's a big barrier that's like going to eventually, hopefully, fade away.
Yeah, I think if I was looking at this as objectively as possible, I believe that for private care, like maybe this generation's like, higher level wealthy patient, right, will have access to this and it will work well for them. Trying to integrate this into traditional healthcare right now would be a disaster.
Yeah.
However, as it gets more efficient, more cost effective, and the philosophy starts to be adopted more and more down the line, then I could see it trickling maybe next generation. This is how everybody approaches their health risks, longevity, optimization. That'd be really cool.
Yeah. I just think medicine lags with that, with the FDA and everything else, just approving things. I think they're super conservative and for good reason. Things should be tested and, they should make sure that it makes sense that what they put in is what they get out. What I'm saying is basically the incentivization to check all these things is really not there from an insurance standpoint. So other places like China, Japan, Singapore, they focus on these longevity aspects because they're incentivized to do so, because they recognize that an aging, sickly population is not good for their economy. So instead they can market the longevity piece, make money from that and pour it back. And it's
interesting.
So I think there needs to be a bigger systemic shift, but hopefully the next generation.
Do you mind explaining that in a little more detail? Because that's kind of new to me. Hearing about, the China, Singapore.
I'll send you the link.
Yeah, please.
But I think it's called the Silver Tsunami, and I believe it's in China, where there is a whole ecosystem built around health span and not lifespan.
Yeah.
So they're a little bit less stringent on what's approved and what's not, and they're focused on they market towards people living healthier longer. So
Wow.
there's a whole industry there, and it's lucrative, so it pays for itself, and it's regulated still, but there's just a bigger focus, and they have more checks and balances, and I think they're figuring it out before us. So
It sounds like it's more adjacent or becoming more of their traditional, this is how we approach health, instead of, again, there's like traditional healthcare and then this whole, longevity field in the US. Is that fair?
correct.
Interesting.
Yeah.
So getting back into QLP, thinking about, we've kind of looked at it from, all right, signal clarification, right? Then prioritization. Now we're going to talk about sequencing, right? So on the back end, how we're deploying these things. So once we have identified, right, what's signal versus what's noise, right? Health risk mitigation first, longevity / health span second, and then optimization third. Now we got to figure out, how do we actually deploy that on the back end? And something we're running into recently, and I've been working to kind of correct within the system, is not everybody has the same amount of time to dedicate to their longevity, or can attack it at the same pace right now. For example, somebody who's in their early mid 40s, is a doctor, is a business owner, is traveling a ton, maybe doesn't have the same amount of time to dedicate to their longevity as somebody who's mid 50s, maybe just had a big exit from their business, pretty much retired at this point, has, 40 hours a week to do whatever they want. They want to really get after it. So I guess the question for you is, how do you think you best approach that, right? Like and we're working on it. We have a solution, but I'm curious, when you have different patients, let me rephrase that question. When you have different patients that, one, are really busy, or two, have a lot of time to dedicate to their health, how does that show up on the back end for you in terms of how you're managing their care?
So I think first you have to just assess the readiness of them to address what comes up on this paperwork and what's been recommended. And I think that QLP is great. All these things are amazing, but there's simple foundations that should be focused on before anything is escalated.
What are those foundations?
So sleep, nutrition, exercise. And it sounds simple, and there's not a lot of money in recommending that, because it's,
anybody can do it.
Anybody can do it. But I would say the good news is that anybody can do it, right? And you although things may be missed on, genetic testing and imaging and all this advanced, expensive stuff we do, I would just say the reassuring thing is that the best thing you could do is treat your body kindly and sleep and prioritize, calm when you can, and focus on your nutrition and activity. And from that standpoint, you should be checking a lot of those boxes. But it's a thing people miss because they're busy and they're working all the time. They're executives and they hit things hard. But as we spoke about, that could be a detriment to your sleep, your inflammation, your metabolism. So I don't know if I answered your question there. I'm just saying,
No, you did.
I typically focus on foundations initially, and then I'll dig a little bit deeper and then focus on things based on their family history and what pops up in their genetic testing and labs.
Typically a good place to start.
Yeah.
It's the foundation.
Correct.
So if you have two different patients, right, that are in different, let's say, seasons of their life, right, and they have different amounts of time to dedicate. I think for major health risk, and we've told our clients this, like, if something pops up as a major health risk, I'm sorry if you don't have a lot of time. We're going to hammer you to get this addressed ASAP, because it's critical and it's very threatening.
Yeah.
But for the longevity, health span, optimization standpoint, somebody who doesn't have 10, 20 hours a week to dedicate to this versus somebody who does, how does that show up on the back end in terms of how you're approaching it?
Assessing their appetite for going to see a doctor, getting another image, getting another lab, and then being realistic about what we can do with the time we have, right? Because some folks, it's a non-negotiable thing. Some folks, like, this is how I need to make money. This is my business. I have to do this kind of thing. So unless we come up with a very great argument that they need to stop everything that they're doing, then you would focus on things that are doable from wherever they are, and there's a lot of negotiations that take place.
It sounds like it. Would setting expectations ahead of time, you think, be super important?
Yeah, 100%.
I think that's what we're trying to do, right? Is like the new component to this that we're adding into the logic system is, really like where are you at in your life? How much time do you have dedicated to this? Again,
Yeah.
the health risk mitigation stuff, like we're not going to pace that, right? Like, sorry if something's threatening, we're going to hammer you and
Yeah.
argue
Yeah.
to tooth and nail that this is something you need to get on now. However, longevity, health span, optimization, right? If you have, a couple hours a week you can dedicate to this, maybe one appointment, one diagnostic, you're comfortable adding one new therapy every 4 to 6 weeks. Like, we kind of establish that ahead of time. And that way it's sustainable. I think that's another issue that we're seeing. And it's kind of human nature. You try to start 5 new habits at once, none of them are going
It's
to
not
stick, or
doable.
only
Yeah.
one's going to stick. So it's also, how do we sequence and pace everything on the back end? And if you look at from health span, longevity, optimization, as long as you're being diligent and making forward progress, the difference of starting everything today versus, hey, we're going to get everything onboarded over the next 12 to
Sure.
24 months, I don't see a big difference in terms of longevity, health span optimization.
Yeah.
What do you think?
No, I agree with that. And I think a big part of that are certain markers, certain biomarkers you could check to prove that what they're doing is beneficial to them. So I think we're in this realm now where it's not every 6-month blood work, and if they have the capacity to follow up with you and you have their trust, then and you're able to show them, hey, look, this is great. This is moving in the right direction. Let's continue this. It just incentivizes them to keep going. And once you can get some forward trajectory, typically it snowballs into something great. So
I'm going to ask for clarity because I'm not sure if you're leaning one direction or the other. You mentioned doing blood work every 6 months, right?
I would just say standard. I mean, in traditional medicine, I would say that's like typically the case, unless you're addressing something acute.
Do you think more or less is better?
I think it completely depends.
Okay.
I think for some people, 6 months is okay. For those that you're addressing a certain situation and there's some abnormal blood markers, I think every 3 months is a bare minimum. Sometimes it's every 6 weeks. So, yeah.
That's great. For somebody navigating their health right now, what do you think matters most?
Foundations. I think foundations. Don't get overwhelmed with all this noise. It's going to be for the betterment of our society one day.
Yeah.
We'll make sense of all this one day. I don't think we're there yet. I would say the healthcare system is fragmented. So find somebody that you trust, find an advocate. Don't be your own doctor. Don't try to Google everything or AI everything. Have a set of eyes that can help guide you through this.
QLP is really focused around the quality of the decision at the time of the decision. How do we take all this information, maybe conflicting priorities from different providers, and make the decision that is best for us right then? What do we deploy, right? What do we pay attention to? What do we defer? What do we ignore completely? So it's called decision governance, right? It exists in finance, it exists in aviation, it exists in military. Think like chain of command, escalation thresholds, right? That doesn't really exist in healthcare right now. We use it for all these other really complex, important areas of our life, but not healthcare. Why do you think it doesn't exist? One, and two, how important is it?
I feel, number one, I would say that it doesn't exist because humans are complex and they have different priorities, and we need to personalize healthcare. So, there's these protocols for machines and there's protocols for humans, but it's very tough to make a human do something they don't believe in doing, So I think it's my job to hopefully get them to that point where they understand and prioritize the same way we do. So
Love that.
I think that's just the big hurdle is people not trusting the information they're getting, or just having a set of priorities that is completely out of sync with what I believe to be important.
Great.
So the second question was,
how important is the decision, right? Like the quality of the decision, instead of just rushing into something and then we'll see how this is in 3 months. If it worked out, it was the right decision, right? How important is it instead to be monitoring the decision itself and saying, are we making the right decision today, regardless of the outcome? Because sometimes we can make the right decision, right, and still not get the outcome we were hoping for.
Sure.
So how important do you think the quality of the decision is?
And I know I sound like a broken record
I
here,
love it. Let's hear it.
but I just feel like it depends, right? Mm-hmm. Because if the decision is being made based on improving lab work. We treat the patient, we don't treat the lab. So if a patient doesn't feel any better or they feel worse, but their labs get better, I mean, let's reassess our priorities here. If it's a 90-year-old patient and their cholesterol is high, give them medication, and because they should be on it per protocol, but their muscle aches and they're sarcopenic and they're at a fall risk. So it's very personalized.
Yeah.
And that's what makes this so complex and so time consuming, is that, you really need to look at the whole picture, and it's tough to do.
I'm sensing that in I've heard the term, I'm sure you have too, chasing numbers, right? In terms of diagnostics.
Yeah.
You just said it, right? Somebody has something showing up on their labs. All we're worried about is getting that number into range. I feel like the concierge has done a really good job of kind of moving away from that. And also, like, how does the patient feel, right? Like, whereas in traditional, non-concierge healthcare, we see it all the time where patients like, I don't feel great, but hey, your labs are good. Sorry, can't do anything for you.
My job's done here.
Yeah.
Because your labs look good.
Yeah. Like that doesn't seem right. So what do you think concierge is doing really well, and how are they getting away from that?
I think time.
Yeah.
I think time. It just gives us time to dig deeper and understand the whole picture. So I think the history is the most important element of healthcare, is just, where are you? Where do you want to go? And let's try to negotiate what we should prioritize. And sometimes you're completely caught off guard and you don't agree, but you try to meet in the middle.
Yeah, absolutely. Yeah. If somebody's trying to be proactive about their health, what is something they are not thinking about that they probably should be?
Their sleep, their stress.
You've been doing a lot of research in the longevity space lately. Is that what's coming up?
Yeah, but I think just personally, it's an issue, having 2 young kids and just a hectic work life, home life. I can feel the difference when I'm well rested and when I'm not. And the science backs that up, with these wearables and all the data that we're getting, you can see your sleep score, and it really is, it's much bigger and way undervalued, the importance of sleep and how that can affect inflammation, metabolism, and just aging in general. So I think just we all need to calm down, de-stress, and sleep more, is what I'd say.
That's great.
Yeah.
Good, solid advice. Thank you. All right, we're going to go rapid fire questions here.
Sure.
Just quick, sentence or two, and then we'll move on to the next. Most overused term in modern healthcare?
I would say probably concierge.
Yeah, you tired of hearing it?
Yeah. I think it's what does that mean? I mean, does that mean access? I think for most people, it means money is going to be paid somewhere.
Yeah.
But I think it's a bigger explanation, and it's there's people wearing concierge hats that I don't think should be wearing them. So
got it.
Yeah.
What do you mean by that?
I just think that, some docs call themselves concierge because they have a cell phone and they'll pick up when you call,
What does concierge mean to you?
Personalized, it's preventative, personalized. It's longevity in my case.
Yeah.
So I think, I think that there's going to be a shift in medicine coming very soon in terms of longevity, AI, and optimization that is not standard of care now. And I don't think it's standard of care in concierge,
and I think it's been a limitation of the system, also been probably financially driven, because you can't scale individualized care. It's very difficult to. With AI, now we're starting to be able to, and how that integrates will be interesting. I assume you're optimistic about the things coming down the pipeline. Is that fair?
Yeah, 100%.
Cool. Early detection.
Early detection.
So
yes.
Let me yes. let me rephrase.
Love that.
Early detection, underused or misunderstood?
Both.
Okay.
Yeah. Undervalued. Misunderstood because, I would just say all of the above. I think it's misunderstood. I think if it put in the wrong hands, it could be anxiety producing, and early detection can save a life, but it's tough to quantify what you're doing, what's panning out. Like, what would have happened if we did not detect it early or intervened at that point? It's tough to know. So
here's a question, right? And this is a conversation I've been having a lot lately. Health in terms of probabilities. right? I look at everything as probabilities. And if we have a certain genetic predisposition, maybe it increases our probability of developing a certain condition or
Yeah.
disease. I could be doing all the right things in terms of my health. I could also step off the curb tomorrow and get hit by a bus.
Right.
So there's a probability that I die tomorrow. And thinking about doing the right things long term, do you think managing the probabilities is a good approach?
I do, but I think that I'd lose sleep over that, and I.
How so? Let's hear it. Wait, I want to dive into that for a second. What do you mean by that?
So managing probabilities, is that what you said?
Yeah, not that like, hey, we're actually tracking, right? Like
Right.
what's Blake's probability of developing this condition, but in terms
Sure.
of like, okay, if we have again this certain signal, right, and there's this probability that again based on there's maybe correlation across structural, genetic, and blood work findings that indicate that hey, this is probably a real risk for Blake. We should mitigate that risk long term, even if it's not something. Hey, it's a risk right now. Use myself for an example: Alzheimer's, dementia,
Yeah.
early white matter changes in the brain, genetic predisposition, high cholesterol, and inflammation markers in my blood work. Pretty much need to make sure I'm taking action now, decades ahead of when Alzheimer's, dementia typically shows up. Is that the right approach?
I think it is, but I think that it's the right approach for you because you
Exactly.
understand it.
Yeah.
You know, you understand what you could do and how that will change your trajectory or delay your trajectory.
Got it.
So I think when it's in the wrong hands or explained in a way that somebody doesn't understand, it could do more harm than good.
Yeah. Asking for real pushback here. So the QLP system, right, does a pretty good job of synthesizing all that data and putting it out to the reviewing physician in a way that I just explained it, right? Is that in the right hands, or do you feel like it's still there needs something else missing from that?
I would have to see how whatever physician you put that in the hands of, how they convey that to the patient, and then how they deal with the interaction there, because that's where that's where the magic happens. You know, is when you can connect with somebody and explain it to somebody, and they could pick up what you're putting down.
I love it.
Yeah,
it's great. Biggest mistake high performing patients make with their health?
The numbers. I would just say, don't focus too much on the numbers.
Chasing numbers.
Okay. I would say focus on the foundations.
What's one thing you've changed your mind on in the last few years with healthcare?
The importance of sleep, I would say, is number one, because, you know, growing up, sleeping more was like something looked down upon. You know, you're lazy, or you're not up and going and hustling all the time. But I've seen that be a detriment to many, many people.
Yeah.
Yeah. I've seen people work their whole lives, make a lot of money, and then, you know, retire into an early grave.
Yeah.
So
this is a personal question, because my wife and I have had this discussion plenty of times, and I've changed my mind on it in the last few years as well. I used to hate sleeping, hate it. I feel like I'm sleeping my life away, right?
Yeah.
And felt like it caught up with me at some point. I was just run down all the time, just looked exhausted. It wasn't functioning at a high level. She's always needed, my wife, like 10 hours of sleep is like her sweet spot, right? Or she's like, I'd sleep for 12 if I could.
Yeah.
Different people need different amounts of sleep.
Correct.
Yeah.
Yeah. I need more
I was hoping
sleep.
you were going to tell me something different.
Yeah, no, that's exactly
she's right. Yeah.
No, tell your wife she's right.
That's awesome.
All the time, even if she's wrong.
Yeah.
But no, I'm the same way. I need more sleep.
Yeah.
And if I don't, I'm not functioning on all cylinders, and, you know, I'm not pleasant to be around. But yeah, I think it does more than just your attitude. It's a reflection of what's happening biologically and the toxins you need to clear out, and you know, your body is like a machine and it needs time to reset and reboot. So any interruption with that is just going to wreak havoc on your system. So,
well, thank you for being here today.
Of course. Yeah,
really
thanks for having
appreciate
me.
it. And we'll have to do this again soon.
Definitely. Thanks, Blake.